Recording, I am. Good morning, everyone. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and I'm thrilled to welcome you to Session 4 of the 2021 Regional Health and Hunger Summit Series. This is a virtual series as part of a larger project where we take a candid look at the connections between the healthcare system and community resources that address hunger. For this series, we're looking at 3 counties in our state, Boone, Lincoln, and Logan. Health and hunger are profoundly connected. Their systems should be too. You can find more information on our website, thinkkidswv.org, and on Think Kids' Facebook page. We hope you'll help join in the discussion because now more than ever in this moment, we need to unite in our efforts to ensure all West Virginians are as healthy as they can be with access to healthcare and nutritious food. There are a lot of challenges to this, and I have met some really wonderful people in these counties who are leading efforts to build these bridges, and so we're glad you're here with us to meet them and join the conversation. Let's get started. So we know that a lot more West Virginians than usual are on the internet right now, and so if you do get disconnected, please know that this is being recorded and you'll have the opportunity to share your thoughts and ask questions at the end of the panel discussion. So go ahead and type them in the Q&A like we have in the past 3 sessions while they're fresh in your mind, and we'll get to them at the end. And with that, let's get underway by thanking our main sponsor for the event series, the Palatine Foundation of Huntington, for their generous financial support. Our community sponsors include Pride Community Services, the Salvation Army, and Unicare Health Plan of West Virginia. Here is our agenda for today's session. We'll begin with a brief look at how anyone can plug into state resources and connect to food pantries in their communities or volunteer opportunities, and how there are both benefits and limitations to these resources. Then we'll turn the video over to our 3 presenters, and then we'll circle back to questions from you if you have them, and then some pre-prepared questions as well. And with that, in preparation for today's conversation, let's take a brief look at West Virginia 211, which any of you can look up online by simply Googling WV211 or going to the website wv211.org. It is operated by the United Way of West Virginia and powered by a program called Aunt Bertha, which that is really its name, Aunt Bertha. Aunt Bertha is an online resource database which powers this database, as well as many other across the country. It is a national company that stores information about available resources and social programs. Companies such as the United Way customize this online directory on the Aunt Bertha platform, and they do this for the state of West Virginia. We started by typing in the zip code for Chapmanville, located in Logan County. As you can see, there is a wealth of information about social assistance programs found in Chapmanville, including housing, goods, transit, information, health information, money information, care, and education. We'll look under the food tab. The food tab has a menu including emergency food, food delivery, help pay for food, meals, nutrition education, and food pantries. We're going to look under the tab of food pantry. What you'd see to the left are 5 pantry listings. 3 are Mountaineer Food Bank listings. I believe, and I could be wrong, that Logan County is served by Facing Hunger Food Bank and not Mountaineer Food Bank. And so if somebody looked for resources from Mountaineer Food Bank, they would not find that information in their county. Also, in the spreadsheet we compiled when we started the Health and Hunger Project, we had 9 food pantries listed in the greater Chapmanville area. Of course, our spreadsheet could be wrong, which is the point I'm hoping to make here. The availability of food via food pantries changes rather frequently. For a massive database like West Virginia 211, which is the best resource for allocating food by county that we have on the state level, it's only as good as the data that is reported to it and information that is updated in it. To the right, you'll see we pulled up one of the listings for Food for Angels, which is run by the great organization One Voice. You'll see that it's a program specifically for children and students. I believe it's a partnership with the county school systems. At any rate, again, great program, but specific program for a specific demographic. The information is really helpful and includes links to organization's website and Facebook page, which we find is increasingly utilized to give this more rapidly changing information, as well as phone numbers and hours. And so while we highly recommend folks visit West Virginia 211 and share it as a resource, it's currently not comprehensive and isn't the whole answer to some of the challenges that is faced on the local level. For example, we didn't see Hungryland Food Initiative on the West Virginia 211 site when we looked at Peach Creek's zip code either. This isn't the fault of anyone. We're certainly not meaning to disparage the website, but in order for the website to maintain comprehensive, updated information, people have to submit that information to the database. Most pantries are run by volunteers with shifting hours of operation. When no one serves as the main contact for that organization, it's very hard to ensure that information is updated. And for a number of reasons, local collaboration is really critical. And it's not just for directing or referring folks to community resources, it also plays a big part in connecting volunteers to work opportunities. Volunteer West Virginia's lead agency for volunteerism in West Virginia. It oversees national service programs like AmeriCorps. It has a COVID volunteer page, but only 9 organizations are listed, and reports are being updated. It reports being updated on February 3rd. Importantly, it's a site that relies heavily, again, on organizations needing volunteers to contact them for opportunities to be posted. For many small pantries and food access sites, their need for volunteers is quite sporadic. We hear often of healthcare organizations that want to connect with volunteer opportunities or schools with students needing community service hours, but they don't know where to connect. As you see from the current map on Volunteer West Virginia's website, there aren't volunteer opportunities listed in the 3-county area. This website is a great resource to have, but again, it's not comprehensive because it's underutilized. And so we have a little context around some of the challenges to referring and guiding people to both food access points and volunteer opportunities via statewide resources. Community connections are absolutely key. And so we're pleased to have 3 panelists with us today to talk about their work. Let's begin by introducing our first panelist, Vandalyn Justice, who is the Social Services Director for the Salvation Army. She is a graduate of West Virginia State University's social work program. She started in the field of social work at the United Way's Information and Referral Program. Following United Way, she started working for the Salvation Army, running their social services program, where she oversees the food pantry, financial assistance program, the Christmas Angel Tree program, and is currently providing community outreach with food box distributions and hot meals out of their disaster canteen. Like Catholic Charities, the Salvation Army coordinates services to address basic needs around the state. They operate a thrift store and service unit in Logan County and provide support to individuals throughout the region. Welcome, Vandy.
Hi, thank you. Well, that kind of summed up some of my overview, but the Salvation Army serves as total Boone, Logan, Mingo, Kanawha, Putnam, Clay, and Roane County. So we're very far and wide. The Charleston area commands presence in Boone County, and Logan has only been in the past few years. The Lincoln County is serviced through the Huntington office. We had an actual location in the Logan area years ago, but finances closed it down. And so the Charleston area command absorbed that area. Our main services are, including but not limited to, our food pantry assistance, our clothing assistance that's utilized through our family stores, rental and utility assistance, more so in the Kanawha County area, but assistance to our homeless with hygiene products, homeless friendly foods, blankets, seasonal warming centers. And we're most known for our Christmas assistance, the Angel Tree program, which helps with toys and food. But through the pandemic, we kind of added a little bit of stuff because we noticed a need. So we started traveling to Dawes and Mann and Chapmanville and Clendenin to do mobile food box distributions. And currently it's only in the city limits at this time, but we provide meals through our canteen on the east end and the west side, but more so on the west side because that's where the need really seems to be. Starting kind of in the meat and bones of the questions, in our experience, food insecurity in the communities that we work in, food insecurity has kind of gone down over the past 6 months, give or take, in all 7 counties that we've serviced. And I believe it's largely due to the fact that the government has provided the supplemental food stamps. So people are using it in the right way. But just to give you an idea, in 2019, between January 1st and May 1st, we serviced 521 households, totaling 1,275 individuals with food requests. In 2020, same time frame, we serviced 900 households, 1,934 individuals. So the pandemic really definitely showed a huge difference. And we were too right in the midst of that pandemic. In 2021, though, we've only served 386 households with food. So that's a huge drop. We went from 521 to 900, and we've only served less than 400 right now. So I've definitely seen a drop in the amount of folks requesting food service. Last year, overall, Boone and Logan, the main request through United Way's information and referral was actually utility and housing. There were only 72 requests from Logan and 44 from Boone. So somebody over there must be doing something right, because they definitely didn't have a whole lot of requests for that type of service. And it could be too that a lot of people are just unfamiliar with 211. So maybe we need to get a little bit more about that information out there. When the pandemic hit, we soon realized there was a need for additional food, especially in the beginning months. Like I said, in 2020, we serviced 900 households in all 7 counties. So in order to provide that, we did partner with United Way and oftentimes Cabin Creek Health Systems, and that's where our mobile food boxes came in. In the summertime, we were seeing anywhere from 200 to 250 families coming through to pick up boxes at any given time in Maine, West Virginia, and Chapmanville. But by the time October rolled around, we were only seeing about 29 families. So we haven't gone back because the request just hasn't been there for us to go back, but we would definitely consider doing it some more if the need arose. As I mentioned above, the biggest unmet need seems to be by far utility and rental assistance. From January 1st, 2021 to April 30th of 2021, the information and referral logged 55 utility requests, 17 housing requests, and only 9 food requests coming from Boone County. For Logan, same, the numbers were higher. We had 74 utility requests, 24 housing, and only 10 food. But keeping in mind these supplemental food stamps folks have been getting, I really think have helped them out in that area. I'm finding across the board that all my counties I serve, rent utilities has been the #1 need, partly due to loss of jobs, of course, loss of hours, staying home with kids, watching, having to deal with them at home the whole time during the pandemic, or just dealing with the illness themselves. While we've only had a few stimulus checks that have touched on the surface of the debt people have accumulated, the supplemental foods really seem to make a big significant impact. Our biggest challenge to providing these mobile food boxes, however, is cost. When we go to Man or Logan with 4, 5, 6 pallets of food, we were lucky enough during the beginning of the pandemic that Salvation Army's national level provided us with free boxes. Now I have to purchase those boxes mainly, and that can cost anywhere from $4,000 to $5,000 per distribution. So that gets a little bit pricey when you start looking at having to purchase them. Let's see, what does access to healthy food look like in these communities? Access to healthy food comes in lots of forms: availability to decent grocery stores, ability to purchase healthy food, availability to find food pantries in the area, educating people on healthy food choices as well. I know there are food pantries in Logan and Boone, as well as the ability for folks to come to Charleston to receive food. Not to mention, we've made numerous attempts to take food there. But as far as the education part, I lack a little bit of knowledge for that. So hopefully schools, DHHRs, those kind of places, WIC programs can help, where Salvation Army doesn't really do that kind of service. I've not had the pleasure of serving Boone and Logan for very long, but as we just kind of absorbed these. We had an area in Logan, but the partnerships that we hope to gain and have more presence moving forward. Our biggest challenges, of course, for providing food in that area is we don't have a home front there. So it's harder for us to take things there. And I know it's hard for a lot of people, especially in hollers and areas and lack of transportation for them to get here. So that's probably one of our biggest hurdles as a Salvation Army for providing food in some of these outlying areas. As far as an overview of services pre-COVID versus services post-COVID, before COVID became a reality, our food pantry looked a little different. Folks could walk in during normal hours, receive pantry, were able to access our lobby. We didn't provide delivery service, and we didn't really have the mobile food pantries. Canteens was only used during disaster. But once the pandemic came about, to protect our staff, volunteers, clients, we had to change things up just a touch. Our lobby was blocked off to just one person at a time. Of course, masks were required by clients and staff. And we tried really hard to encourage people to make appointments, especially if they were driving from far away. But mostly because the pantries, we wanted to avoid the crowds of people. A lot of folks just didn't understand the importance of not being crowded and having their masks on. All of our applications were done by phone, email, or fax, or by collaborating with other agencies to get that client's info. And probably the biggest change was that we started delivering food boxes to our senior citizens, those who might have been ill with COVID or susceptible to getting COVID. We didn't want them out and about if they didn't have to be. The mobile food pantry at this time has only been in Kanawha County. We serve about 300 meals at each canteen serving, and we've had some really good success with that. Our numbers as a whole, in 2019, 1,186 households were served with food. 2020, 1,478 households were served with food. Right now, we're only 6 months in, and only 387 households were been served with food. So it's not my number one request, but I'm sure that there are folks out there, especially our senior population. I feel like that they're the ones that have probably been my biggest raise in folks asking for food assistance. Let's see, where are we at here? So communities, who do you know in your communities who are trying to address the lack of healthy food? Well, besides myself, United Way has played a big role in helping us locate folks who are in need of food, or the 211. But you do kind of lack in the small churches and places that I'm unaware of. So being able to learn more about those places would be really helpful. There's still much about Boone and Logan that I have to learn about, since I'm located in Kanawha County and I don't have the availability to get there very often. But we utilize the numbers from 211 to show what needs out there, and to help people find what's out there when we can't. These partnerships help folks in these areas, because United Way has been our biggest ally in getting food assistance to Boone and Logan. We partner in finding right locations, gathering volunteers, actually providing food when needed. Without these partnerships, Salvation Army wouldn't be able to do it on their own. Seasonally, we partner with Nybert United Methodist to hand out toys and food, and the barn in Boone County, which has also just opened a pantry. The schools have been a big help. They provided us with outdoor space to do our food box distribution, so that partnership has been really valuable. And as far as the other collaborations, sometimes when those agencies are really spaced out, it's hard to form them, but being part of groups such as Kanawha Valley Collective, of course, United Way, and the churches and whatnot, we've improved those collaborations Our location here in Charleston kind of alienates us from people in those areas. So having the ability to help go there has really played a big part in helping folks get the food that they need. My biggest wish is that DHHR agencies in all area would play a more active role in reaching out and learning what's out there for their clients. That's really the jumping point most people have when they're asking for help. So I think that really bringing them in the inner circle would definitely provide more positive outreach for folks when they go seeking assistance. I also know that the quick guides, the 211 quick guides, dispersing those in places that people frequent, such as agencies like the Cabin Creek Health Systems, where people to go to get their health needs met, or the free clinics, other agencies, just so they have, something to hand out to give people so that they know where they can go to get various types of help. Basically, that's all I kind of have. If I missed over something, please feel free to ask.
That's great, Vandy. Thank you. And I have a couple questions for you, but I'm going to save them till the end. So I'll ask you then, and we will move on to Amanda. And Amanda, I want you to correct me if I say your last name incorrectly. Komorowski. Is that close? Great. Okay. She is the retail donation coordinator for Mountaineer Food Bank, and she runs the Feeding Families Prime program, which provides health education and nutritious food information to some of the most food insecure zip codes in West Virginia. FFP takes a more holistic approach, traditional food pantry. It supplies the community with food and hand-picked healthy foods with extensive education on chronic illness, partnered with community classes such as cooking classes, fitness classes, and courses to help with unemployment assistance, anger management, CPR classes, and much more, which I'm excited to learn about. They had launched their program in Whitesville and Boone County in late February. So thanks for joining us today, Amanda.
Yes, thank you guys for having me. So to start out, Feeding Families Prime and Mountaineer Food Bank only covers Boone County. For the other counties that we're focusing on, Lincoln and Logan. So for this portion, I'll just be talking about Boone. You're right, Facing Hunger does cover the Lincoln-Logan territories. But for Feeding Families Prime in Boone County, we launched earlier this year in Whitesville at a place called Shepherd's Heart. It's on Coal River Road. And as far as services Mountaineer Food Bank offers, we have many different programs in Boone County. So we have two large food pantries. We have Shepherd's Heart, and that's in Whitesville, and we have Amazing Grace, and that's in Seth. We really would love to have some more member agencies in Boone County. So if you guys know of anybody that's interested in starting out as a nonprofit in the area to deliver food or serve food, please check out our website. It's mountaineerfoodbank.org. For our territory for Boone County, just in this first quarter alone, Mountaineer Food Bank has distributed over 314,000 pounds of food. And for Feeding Families Prime, we've had 7 events in Whitesville, and in those 7 events, we've distributed close to 30,000 pounds of food. So we are very proud to be able to help the great people of Boone County. So that's kind of like a brief little overview of kind of what's going on. And in my experience, how would I describe food insecurity in the community where I work, which I'll focus on Whitesville. Food insecurity is really difficult for Whitesville. So whenever I went into it, these people were used to having really good paying jobs through the coal mines. And since those have left the area, they're really discouraged. And it's really hard for them to get back on their feet because there's not a whole lot left for them. And they feel very, very hopeless. So a lot of the people that come to me through the Feeding Families Prime program, they're looking for job assistance. The food is great, but they come to me and say, hey, is there any way that your program can pay for CDLs or EMT training, anything like that? So that's kind of where the biggest need is for my FFP members. They love the food. They need the food. There's only one grocery store in Whitesville, And I did get the privilege to go to a wonderful store. But as far as being able to feed the whole community, it's very small and it's very expensive. And there's only one soup kitchen in the area. So that's kind of where there's a food insecurity issue. Do I believe the needs are being met to the people of Boone County? No. There's not enough member agencies. There's not enough food pantries and soup kitchens. The country roads, I mean, even if you're 5 miles apart, you can be a world apart because there's a huge old mountain in your way. So I would really like to see more help for Boone County people, more grocery stores, more affordable grocery stores. You know, there is another one, but it is pretty expensive. So that's kind of where I'm at there. There is, of course, some food insecurity. So what does access to healthy food look like in the communities that I serve in Boone, and what are the challenges ensuring it's available? So the remoteness of Boone County is its own problem. So it is hard to, keep on bringing trucks in and out of there. Usually whenever I do an FFP event every 2 weeks, I mean, it's an all-day trip for us. So that's been a little bit of an issue. And as far as the challenge, another challenge is infrastructure. So we bring healthy, nutritious food to Boone County, and that's usually not shelf stable. A lot of these shelf stable foods are high in salt and sugar and all that stuff and preservatives. So I want to get these people healthy food, but that requires refrigeration, freezers, proper storage, and the infrastructure in Boone County does not support that. Trying to find a place where I could put a walk-in freezer or an electrical grid that I can hook up to for the right storage units has been very difficult. Handicap accessibility, just even making an FFP prime spike ready for people to come into has been very challenging. And of course, internet services. I am really big into making sure that we are all connected as nonprofit agencies. That way we can work together. But whenever you go somewhere and there's no cell phone service and no internet, it is very hard to communicate on site. So I would say my biggest issues is the remoteness of the place, technology, and infrastructure. So that's the challenges. I believe that if we could all come together and work on that, there's nothing we couldn't do in Boone County. Overview of services, pre-COVID and post-COVID. So I started Feeding Families Prime earlier this year, so we was kind of right in the middle of COVID. But I started working on FFP before it was launched about 2 months before COVID hit. And this program was originally wrote to be a community program where people would come into the Prime sites and they would grocery shop, and it would be more of a holistic communication group type feel. It wasn't where we just push food in your car and send you on your way. So we really have had to revamp that. So post-COVID, what it looks like in Whitesville is we have people line up in their cars and we do drive-bys. Education is just as important to FFP as what food is. So what we do is I register them while they're in their car. We all have our face masks on. We do make sure to practice the safety protocols. And we ask them, which members are in your car. We give them fresh, healthy, nutritious foods. We check on them because I believe that this program is completely holistic. Like if they're having trouble paying their power bill, then I try to, coordinate relief efforts for that. So after I talk to them, I get them their food, then WVU Extension agent follows me, and then she provides the chronic disease and general health education. So that's how it's looking like post-COVID. Now, someday I'm hoping to go back to normal. And in that instance, what we're going to do is we're going to completely remodel Shepherd's Heart Food Pantry. And we're going to do online classes, community cooking classes. It's going to be a completely different feel. We're going to have a walk-in freezer, a walk-in refrigerator. But for right now, we're having to do drive-bys due to COVID. Who do you know in your communities who are trying to address the lack of healthy food? So all of you guys, of course. WVU Extension has been my savior in this program. They are at every single one of my FFP sites. And a lot of nonprofit organizations in Southern West Virginia has partnered with me for my Southern sites like McDowell and Mercer. So who do I know in my communities who are trying to address the lack of healthy food? Never mind, I already read that one. Are folks partnering to address challenges to lack of nutritious food? So absolutely. I am so proud of the people of Boone County. Anytime our truck comes, our volunteers and our FFP members come out and help us unload the truck. I've never seen community support like I have in Boone County. My FFP members are my volunteers. They always rally around me and they're always so appreciative. I never have trouble finding volunteers or folks that are trying to help me get food into the county. What recommendations do I have to improve collaboration between my organization and food resource providers in my community? Just these webinars are great. Always staying in constant contact. I'm all about networking. I always say the more the merrier. For Boone County, I'm a little disappointed because my only education that I'm able to provide is WVU Extension. And my Mercer County site, I have anywhere from 4 to 6 education providers for that site. So I always say the more the merrier. So if you guys would like to come to Whitesville every other Thursday from 4 to 6, I would love for you to share more education. And that way we can kind of network more and maybe we can get you onto some more prime sites. And how do people connect to services in the communities that they serve? So there's many ways to connect with Mountaineer Food Bank. I'm very proud of all the ways that we're trying to get to know people. So of course, always say dial 211. Those people know what they're doing and they can get you hooked up to us. You can go to mountaineerfoodbank.org. And if you scroll down on our homepage, there is a schedule of every single mobile that we are doing for the following couple weeks. You can like us on Facebook. We post on Facebook all the time. We're also on Instagram. We post, where we're going to be and what's going on with us. You can call the food bank. We're always here answering the phones. There's many different ways. And one of my favorite features of Mountaineer Food Bank, and I recommend you guys checking it out, is you go to mountaineerfoodbank.org. In the top right-hand corner, there's a link that says More. If you hover over More, there'll be a link that says Find Food. You click Find Food and it will bring you to the map of all of West Virginia, and it will show you in county form. So if you click Boone County, it'll show you all of the food pantries and soup kitchens we have in that area. It'll tell you the name, the address, the hours, and their telephone number. So anytime somebody comes to you and says, I need food, where can I get it? You can easily just go on our website and we have all of the information listed. As far as gardening programs, so I am so proud of WVU Extension. My extension agents has just taken my community garden and kind of ran with it. So in Whitesville, there is a small community garden. It really needs revamped. So if you guys would be interested in volunteering with me to have kind of a community garden revamp day to where we can fix it up, I have the money to buy the seeds and the soil and whatever you guys need, but I'm definitely interested in kind of making the community garden a little bit of a better place to garden. It's a little rough right now. So that's all I got for my side. Oh, and as far as the slideshow, so gender application. So every FFP event, I make people fill out applications and surveys so I kind of understand people better. So most of my FFP members are women and they are older. There's usually like a 1 to 2 person household. So there's a lot of grand families that are FFP members. And the next slide shows you kind of the household sizes that I'm dealing with. Like I said, there are a lot of 1 to 2 people households. And then the next slide, I was really floored by this. So I always ask people, what are your chronic conditions? Because whenever I make them a food box, I want to make sure that it's a healthy food box and I'm not trying to hurt their health. So I was thinking mostly it would be, diabetes or high blood pressure, but the ranges of the chronic conditions in Boone County is so sad. You can kind of see here, and I have these on my email. If you guys would ever like a copy of this, I would be more than happy to provide it for you. And then the next slide. So I always ask them what health topics they're interested in learning about. I want to know what they want to learn about. I don't want to give them information that they're just going to look over. So if you guys have any, I don't know what GHU is, I don't know, but if you guys have any classes that you could teach on with this, like I said, every other Thursday on Coal River Road in Whitesville from 4 to 6. This is kind of what they're wanting to learn about. And the next slide is, what are your most immediate needs or your biggest issue in life? So what I have found through FFP is, yes, there is a need for food. And Mountaineer Food Bank, we are coming through with flying colors and we're doing the best we can. But these people, they don't have a refrigerator to store some of their food, and they don't have a freezer. They don't have power. They don't have gas. I mean, there's just such a great need. So what I do is I ask them what their needs are, and then I try to coordinate with other nonprofits to help them with that. There's a lot of need for home repairs. I remember Vandalyn was saying that. Utility assistance. They're really struggling with the infrastructure of their home. So if we could help with the infrastructure, we can keep on providing food. Also, there's a really big gap in mental health needs. A lot of people that are FFP members are struggling from schizophrenia, depression, and the list goes on and on. I have one guy that actually carries a gun with him everywhere he goes because he thinks a possum is following him around, and there's no possum. It's very sad. There's not any help for these people as far as mental health goes. Also, illiteracy. This site had the most FFP members that were illiterate. I actually had to get 2 volunteers just to sit down and do applications for FFP members. So I would really like to see even basic adult learning education classes. And the next slide is my people. So this man, we were helping him fill out his application. My volunteers up on the top corner, I have the best volunteers. Boone County always comes through and helps me. And then in the bottom picture, that's my extension agent. She goes car to car after I check them in and check on them and give them food. And she teaches them. And I'm telling you what, Boone County wants cooking classes more than any other FFP site. Every time I talk to them, they're asking, when can we do classes? We want to just sit down and visit and learn. They're getting very tired of the carpool learning. So we're really hoping to get that on soon. And that's all I got, guys.
That's amazing, Amanda. Thank you. So much there. I hope you get some more questions at the end. And our final panelist is not Sue Burton, as she couldn't join us today. Our pinch hitter today is Michael Tierney, Executive Director of Step by Step. For nearly 33 years, he has served as the Executive Director of Step by Step, a regional community education and leadership organization with a focus on children and family programs serving rural communities, and he's done extensive outreach in both Lincoln and Logan counties. He holds degrees from Brandeis and Harvard universities, and recently he co-taught a graduate seminar titled West Virginia Activists Stories for Social Change through the Marshall University Graduate Humanities Program. Thank you for joining us today, Michael.
Got to unmute. Some of you who've been on the series, I was up a few weeks ago and mostly focused on step-by-step children and family programs. And I'm going to try and not be repetitive because we do a lot of different things, and there's some community organizing and development resources that I think are particularly useful for us to think about. But our day-to-day work with Step by Step, we have 15 after-school sites, 16 mentoring sites. We're committed to working with families from the birth of their children through graduation from high school, and in a place like Big Ugly Creek, where I am Zooming from, and the Big Ugly Community Center. Then it circles around, and we're working with the kids of our kids because we've been doing this since 1995 there. But today I want to kind of particularly focus on things that are not direct kids and family programs, but some of the ways the community is organized, and tools for organizing to address both food insecurity and healthy lifestyle and other health needs. We've been involved with addressing food security since we began working with kids. The very first program that we started at the Big Ugly Community Center, which is a reclaimed 4-classroom elementary school that closed in the mid-90s, we immediately began feeding kids before we'd ever heard of the Office of Child Nutrition. And the following summer, we started our first summer program in 1996, and that's been going continuously. We gradually learned the ropes of getting after-school snack funding, summer breakfast and lunch. So all of our sites, if the kids are there in the summer, they get breakfast and lunch. If they're there in the school year, they get a supper and a snack. And that, we probably helped start about 30 of those programs across the region. And if I were going to emphasize one thing, and it's a little late now, though I was heartened to hear on the radio that there are 50 more programs than there were last year, is pull together in your community and make sure that you have accessible summer food programs. It is so easy to fund. The Office of Child Nutrition is the most wonderful branch of state government to work with, but we've had a real decline up until this year in the number of places. In my opinion, there should be every middle school enrollment area minimally should have a in-person food program every summer. And we're a long, long way from reaching that. And I'd be happy at any time to, trade ideas about how you develop it, but also the Office of Child Nutrition people are just wonderfully, wonderfully helpful. Another aspect is, while community gardens are cool, sometimes everybody's garden is nobody's garden, and you have a hot weekend and nobody shows up and everything dies. We have emphasized working with families to start their own home gardens since 2011 through a program called Grow Appalachia, based out of Berea, Kentucky, out of Berea College. And we work with families, got a lot of these very small households, although occasionally a number of the grandparents are raising grandchildren as well. And they have to commit to coming to 6 workshops. We do workshops on garden planning, garden planting, garden maintenance, healthy heart cooking, food preservation, and then either winter gardening or putting your garden to bed. My wife is a great gardener. We have had spinach all winter through putting kind of a cold cover over things. And we're still eating squash and sweet potatoes from last year's garden. My dream is to get everybody to grow squash and sweet potatoes. They're incredibly healthy, much healthier than Irish potatoes. And it would give families access to homegrown, healthy food year round. If they make that commitment to come to the workshops, we provide organic fertilizer, seeds, plants, a really good tool every year. And then as additional funds are available, food preservation equipment. We've been trying to get everybody a little sealer so they can freeze vegetables. And also through, again, wonderful partners. People have talked about extension. We always offer canning workshops and other things around food preservation. We've also worked with groups like the day reporting centers, recovery homes, and after school programs to encourage them, again, sometimes in partnership with the initiatives with WVU Extension Service, and a lot of things around healthy cooking. In addition to just find your local extension agent, and they are very much wanting to come out and provide cooking classes. But we also have augmented that with a program, it's a model called Supper in a Sack, but we'll demonstrate and have a workshop where people in the past getting together, this year we've been doing it through Zoom, on how to make a healthy meal, how to substitute some of the things that are not so healthy in people's favorite dishes. But then we raise the money to send the ingredients home with the families and have them replicate those meals at home with the hope that that'll become part of their regular repertoire. I think those are just two basic broad areas. Find your after school programs in the area. They are already dealing often with the most vulnerable kids in an area, and they can become a means of food distribution and support. And think about partnering with various people about community. Again, community gardens are great, but it's even better if you can help people start their own garden at home. You're less likely to have disappointment and more likely to build lifelong, incredibly healthy habits. Another area that has been very important with our building our programs and our community resources has been working with mini grant programs. There is a surprising number of groups that are eager to give a mini grant to a local community group. And the best example is Try This West Virginia, which is an organization that grew out of a series of articles that founder Kate Long wrote in the Gazette, probably 20 years ago, called The Shape We're In, addressing the obesity and other unhealthy lifestyle related diseases. And Try This has given out hundreds and hundreds of mini grants. They usually have this wonderful big conference, which of course hasn't been able to happen for a couple of years because of COVID, but they're still on June 17th. And I'm going to give a link for Kelly to send out to folks. We'll have another mini grant project. And this is particularly dear to my heart because a couple of our Vista, Liz Brunello and Rebecca, helped shape the format of that mini grant program from other work step by step had done in the past. These working with a small group of people to think of a small $1,500 to $3,000 project is a great way to get the community to focus on how to address its own needs. The Try This format will help people learn how to pull together allies. It will help people learn how to set goals and objectives and means of documentation and evaluation, and how to do a simple budget. They have great technical assistance, and the kinds of things we've done over the years with Try This mini grants have included those supper and a sack programs, have included helping people, new gardeners, set up raised beds and get materials. We just gave away 175 baby chicks about 2 weeks ago. I've got 6 of them on my front porch here that my wife is raising. We've done one of the things that got slowed down because of COVID, but we've got the money to do it, is we're putting in kind of a walking track garden that will have raised beds. That there'll be a raised bed with peas, there'll be a raised bed with cherry tomatoes, there'll be a raised bed with spinach, but particularly things that people could actually harvest as they go around, and again, see how easy it is to grow food that kids will actually like. And then in addition to healthy food and dealing with food insecurity, Try This also really emphasizes physical activity. So bicycle clubs, working on getting mindfulness programs, and karate and self-defense going is all great stuff. And a third area that I'm going to very quickly go through is the use of national service. I like to say step by step is the house that Vista built. In 1995, when we started the community center, I had our first 2 Vista, one of whom was Scott Finn, that some people may remember as the director of West Virginia Public Broadcasting for many years. But Scott slept in my office because he didn't want to commute from Charleston, and helped us get the Big Ugly Community Center going. We also got the Lincoln County Family Resource Network started. We also got the Lincoln County Starting Point Center going. Many of the best practices we have with our after-school programs were shaped by Vista. Vista do capacity building, and any nonprofit can apply for a Vista through a number of intermediaries that we have in the state. Again, I'm happy to talk with you about Vista. If you want to get your feet wet with national service, try and work with somebody to apply for a summer Vista slot, which is a 10-week slot, particularly focused on food security, and where you can have Vistas can then do direct service and help have a summer food program going. And then AmeriCorps and AmeriCorps Vista and AmeriCorps are different things. AmeriCorps is direct service. It's more complicated to get those because you have to have a project that has at least 10 people at a time. But I believe High Rocks currently, which is a wonderful organization over in Pocahontas County and several other counties, High Rocks, I believe, has an AmeriCorps program that individual groups can apply to have one of their slots that includes working with people on setting up community gardens. They've done lots of other cool things with that. And then the fourth national service option we've taken advantage over the years, building our walking track one year, rehabbing our community center, working on a family literacy project, is National Civilian Community Corps. It's modeled after the old Civilian Conservation Corps that they had in the 30s, but it's the NCCC. And with that, you would host a group of maybe 6 to 15 volunteers that come from all over the country, although they're a team that works together year round. And you host them, and you've got from 1 week to 2 week people to help with a particular major project. And we've had those folks come through in West Virginia. They're always wonderful. You got to figure out how to feed them, and you got to figure out a place where they can have some cots or inflatable mattress space. But it's another great way. And again, I'm very, very happy to email back and forth or chat about how you can make use of any of those national service streams. Kelly, what kind of time I've got? Because I want to address some of the issues, but I wanted to go over those things. How much time do I have left?
Honey, you have about 8 minutes.
Okay. Well, I do want to respond to some of the big questions. What food insecurity looks like. Step by Step is primarily in Lincoln, Logan, and Kanawha counties. In Kanawha, we focused since 2008 on housing developments. We work very closely with Charleston Kanawha Housing Authority, but we also have been piloting a teen center that we've kept going a little bit, even, and still had some kids come in for homework help at Risen City Church, where my colleague Michael Farmer is pastor. And then we are applying for money to, the city of Charleston wants us to get some more program going through Parks and Rec. So we hope to reopen the Roosevelt Center as a community education center and have a teen center there as well. And then in Lincoln and Logan, the Big Ugly Community Center, which I like to think of as being at the epicenter of the Tri-Cities area of Harts, Chapmanville, and Danville. We're about a half an hour equidistant from each of those communities. No cell reception, no broadband, but we've been serving people continuously since the fall of 1995 there. The things that we have seen, and then Logan County schools, one of the reasons I think that Salvation Army is seeing some of the decrease in food requests is Logan County Schools has been very, very committed to getting food out to families. I've been very, very impressed with them. And as I will address in a minute, no one of these systems can pull it off on their own. No housing authority, no school system, no agency. We've got to work together to reach the people falling between the cracks. So food insecurity in these communities look like if you're a family with crappy transportation, then you're not likely to have very good access to a grocery store that's going to have healthy food. Buffalo Creek, one of the poorest communities. Curtis is way, way up at the end of Buffalo Creek. One of the poorest areas in the state lost their grocery store during the pandemic. So all they have is a Dollar General or a Family Dollar. And we all know how salt and corn fructose, sugar laden the food that you get from that kind of place is. And then I really want to underscore again, transportation, even with the efforts during the pandemic, and even if you've got summer programs, food programs at middle schools, that again, I'm very grateful Logan County commits to consistently. You've got families that don't have transportation there. One of the commitments we make with Step by Step is all our programs are free. We always feed kids, and we always provide transportation, because the families that need it most cannot get their kids back and forth to a program, even if it means they know they're going to eat better, because they literally don't have the gas money. During the pandemic, if the food was being put out through distribution centers like the local middle school, well, what happens to the family doesn't have a reliable car? Very creative community response was that people would go and collect food for a number of people. And we tried to help out a little bit by giving gas cards to some of the people willing to do that. That might have not been particularly kosher, because I think other counties will not distribute food unless it is the actual family just getting food for their own kids. We've got to break through that. We need a way to vet volunteers so people are not ripping off food for just themselves. That's fine, but we've got to accept that we have a huge swath of West Virginians that do not have reliable transportation, and their kids will go hungry in the summer and in a crisis if people cannot help them out. Even with, and this is one story that I will repeat from last time because it just was so chilling to me, even the schools, as Logan County did, that will take the food out to individual drop-off centers, bus pickup centers. There was a kid that showed up, like an 8 or 9-year-old kid, tiny, one of those little tiny kids that hasn't had their growth spurt yet. And luckily, one of our AmeriCorps was on the bus helping getting food out, and noticed that this kid was going to pick up. At that point, they were doing weekly drop-offs, so they'd had 5 days of breakfast and lunches in boxes. And there was no way this 8 or 9-year-old was going to be able to get that back home. So our AmeriCorps volunteer, they paused. She helped them go back up. They had to go down a hill. They had to go back up. And they found out the reason he was there was because he was the most able family member. The mom had an infant and a couple of toddlers, and there was no way she was going to go and wait by a rural highway with that batch of kids. And she still wouldn't have, she'd had an infant in her arms. She still wouldn't have been able to carry the food home. So figuring out how we find out when people have that. I noticed one of the questions had to do with stigma. People feel a great deal of stigma about having challenges about feeding their kids. We have been trying to do some documentation of the impact of COVID on families, and nobody wanted to go on camera because they felt embarrassed that life has dealt them a hand that it's hard for them to have enough food. Now, people are very ready to talk about education and how frustrated they are with lack of broadband and that kind of thing. So we are still gathering some stories, but we have to figure out a non-shaming, just helpful neighbor approach to be able to get up these hollers and get food to folks. Some of the recommendations, again, why I love mini grant projects, is at a very small community-based level, pull together your partners. And that's why if you all get together to plan a mini grant with some community leaders, somebody's part of a 4-H club, somebody's part of Little League, just who's already trying to do things, somebody's part of a local church, who's already out there trying to think through and are addressing families' needs informally, that we want to help connect them to some more formal resources. So they're not just doing it out of pocket, or the resources can be more consistent. Collaborate also to get beyond the limits of different funding streams. Step by Step primarily works with K through 12 kids. That means most of our funding streams do not allow us to provide programs for early childhood or adults. So during COVID, we looked for other funding streams to make sure we could also give food and cool family learning packets to toddlers. And on the other end of things, that we could buy Kroger gift cards or to give to families to be able to get food for adults, because the food we're delivering from Office of Child Nutrition is meant for people from 0 through 18. And then also you run into all sorts of things where you can't cross county lines. Greater Kanawha Valley Foundation covers Lincoln and Kanawha. United Way in this area covers Kanawha and Logan. And trying to blend your resources so you don't have to tell somebody you can't help them out because they don't quite fit who your funder's catchment area is. And then the other, I'm sure this is preaching to the choir here, but on a very practical level, again, Partners for a Mini Grant, or to just have kind of a local club that wants to talk about food security and healthy food. Your local family resource network, starting point centers. Partners in Prevention is a program through Team for West Virginia's Children, Prevent Child Abuse America, and they have $5,000 mini grants that I think go out to 53 of the 55 counties. Whoever your local PIP group is a great group of folks to know. They have a little tiny bit of flexible funding, and the way those groups stretch it is just awe-inspiring. I'm actually, when I get done with this morning, I'll be popping on to the annual meeting of that group that's happening this afternoon through tomorrow. I also want to mention, try this West Virginia. Kelly, I couldn't figure out, because I didn't see a chat function, but I'm going to give Kelly a batch of links that she can email out to folks that'll include try this. They have a mini grant due June 17th. You got plenty of time to pull together a group to plan. The Team for West Virginia's Children is the one that has the partners in prevention groups. You can get the list there. And then another group that sometimes has many grants and just does extraordinary community connections is the West Virginia Community Development Hub. Stephanie Tyree is their executive director. I'm going to send, they have a workshop this Friday on Start Where You Are, Supporting Your Community's Assets. And then on June 3rd, Bringing Young Voices Forward, Engaging Youth in this kind of work. I'm going to send the email for Kelly to forward to you. It's not exactly easy to find their coming events on their webpage, but it's really worth reading their webpage. And I'll also send out my email and any of these things, along with, I'm very passionate about children's literature. You can get fun books about nature and gardening out to kids, along with seeds, or we even had kids help patch and raise baby chicks at the community center a couple of summers ago. So it's never too early to try and get little kids interested in these kinds of things. I think that's for me for now, and I'd love to make sure we have plenty of time for people's questions and for Kelly's questions.
Thank you, Michael. That was great. Thanks to all our presenters. Let's see what we've got in the Q&A box. The first remark is from John. It says, got it. Thank you for your response. I'm going to guess that he's responding to another question. Darlene says, Kelly, I see you're recording the event. Is there any way I can get a copy of it? Sure, it is. They are all up on our YouTube channel, and I will send that link. I'll be sending, since this is our final session in the series, I'll be sending an email probably tomorrow, but maybe the day after, with some of the links that Michael had just mentioned. And then, of course, we're going to be writing a final brief of all of these great things that we've heard from our panelists over the last few sessions. And it'll have links on how to get much of this information as well. So thank you for those responses. Please, everyone know, oh, thank you, Vandy. I see that she figured out the Q&A box and responded to John, so I appreciate that. And we have some pre-prepared questions, but please know that if you have any more additional questions, please write them in the Q&A box. And we will start with question 1. It's a bit long and it has a couple of parts to it. All three of you play that pivotal role in connecting people to resources, but you're doing it from different organizations and systems. In your opinion, within your organization, is the effort to coordinate services well coordinated and organized? So within your organization, do you feel as if, kind of as Michael was articulating, but all three of you did, do you feel as if there's kind of an infrastructure on how you respond? And then outside of your organization, within your community, are efforts to improve access to healthy foods well coordinated and organized?
So I'll start. As far as within Mountaineer Food Bank's organization, we are a very well-oiled machine. Our administrative program staff is all out here at our Flatwoods Outlet Mall office, all in cubicles, so we bounce ideas and schedules off of each other. And as far as outside the organization, we are doing great, communicating with other organizations to try to partner to bring out healthy foods. WV Extension was the first agency or organizations I partnered with, and that has opened up so many doors to other organizations for Mountaineer Food Bank. So I have not had any issues. I would love to see more coordination. I'd like it to kind of be like an everyday thing where we touch base and I say, hey, I'm going to be in Boone County this Tuesday. Anybody want to come? But for right now, I'm very impressed with the organization we have within our organization and outside of it.
Well, as far as Salvation Army goes, I'm a department of 1.5. So it's me and when my boss has the ability to help us, but and the Boys and Girls Club, they're kind of their own entity. But having worked for United Way's info and referral prior to this job kind of gave me a really good solid foundation and kind of gearing people in the right direction for resources. But when in doubt or when I'm not sure, I definitely utilize those programs like 211. Simple Google up something if I can't find it, to try to help people, connect to the right places and the right services. So in the organization, me and my receptionist work the best we can to get the right information to the right people. Outside, the pandemic has definitely brought us closer to a lot of other organizations to make effort to improve both referrals and access to healthy food. We plan to hopefully work more on that, especially in areas outside Kanawha County. Sometimes it takes, we have little staff to work with. So that's probably our biggest hurdle and our biggest challenge, because food isn't the only thing that I do. So when it's just me, I can only go in so many directions, but with the help of United Way, Kanawha Valley Collective, who do service parts of Boone, Logan, Clay, other places that we service, we do the best we can to come up with some innovative ideas and getting food out there. And of course, the food banks have played a huge role, because I work with both Mountaineer and Facing Hunger Food Bank, because I service different counties with different resources. But they've all been instrumental in helping me get out the food that we need to get out.
I would say there is a great deal of heart and intention, and sometimes the follow through is difficult, either because there's a lack of an anchor project or contact in a particular community, or COVID, just as everybody knows, is complicated. People are just exhausted after this 15 months. And living here on Big Ugly since 1987, the farther away you get from your county seat, the harder it is to connect to resources. It's just true. To be blunt, one of the reasons I stopped joining some kind of regional and county level things, because it seemed like if you weren't willing to travel for an hour to go to the county seat, then they weren't very interested in your part of the county. And Step by Step's kind of specialized, way up Buffalo Creek, Big Ugly, and housing developments, which are as isolated in their own ways, even though they're right in the city proper. One of the reasons I'm big on summer food programs is it's a limited, it's usually like a 6 or 7 week time to bring people together to say, how can we make sure kids get fed, and use that as an anchor for a lot of collaboration. And then when you get done with that, they go, kids are still hungry. How are we going to make sure that they have access to resources? And it kind of builds a quick, successful experience for people. And the one thing, I think 211 has gotten a lot better. I'm thrilled that it's under United Way now, because I think it really gets the TLC it needs. But at a community level, the contact's only good as someone's going to pick up the phone. And so I always encourage people to vet. If it's an issue area, go ahead and vet and call and see how difficult it is for us, who are pretty pushy and advocates, to get a hold of somebody and figure out resources before we pass it on to a family that may be intimidated because they've run into too many dead ends so far. I underscore that extension is an absolute great foundational resource. And it's just, how can we come up with concrete short-term projects that get people actively working together and work out the kinks of who really still, with our best efforts, has trouble reaching us.
Great responses. Thank you. Let's go to question 2. What role do you think stigma plays in engaging individuals and families to access services? I know you've touched on it a little in your presentations.
So the stigma that FFP gets is most of our sites, excluding Boone County, we offer free Narcan, and that is just through one of our education services. So there's a stigma with that there's, a lot of FFP members in recovery, but the most that I run into in Boone County is they don't want to take enough food for them because they think they're going to take from the next person.
Oh,
And I always show them how much food we bring and we've never run out of food, and how, the FFP money was from the governor's budget. It's from our tax dollars. I say, listen, you have already paid for this. This is a hand up. It's not a handout. Please take as much as you want. We will always have enough for the next person. So really the stigma, it's not so much shame anymore. It's just them trying to look out for their neighbors right now. They feel like the food bank and other organizations don't have enough to give, but in reality, we have more than enough, more than we've ever had before. So that's kind of where the stigma is that I'm dealing with in Whitesville. Please just come and get it. That's what I tell them.
it's interesting you say that, because it's something that Michael touched on, and it's something I think something that came up during, kind of the height of COVID. And that was this, there were people who seemed to believe that people were gaming the system, and that there's always kind of a few people who are skeptical that those people who are accessing services don't really need it, and that may feed into stigma. So I think that was.
Yes, absolutely it does. And when people come to me and tell me that, I tell them, you will get hungry every 4 hours. It's not that you get food this one time and you're playing the system. In 4 hours, it don't matter who you are, you're going to be hungry. It don't matter if you have $1,000 in your pocket or a quarter. Hunger is something that will always be a battle for each person. And with FFP, there's no income guidelines. There's no guidelines whatsoever. You just come and you get the food. So that's kind of how I respond to that.
One of the reasons I like the individual gardening programs as opposed to community gardens is that what we run into is people don't want to take the vegetables from the community garden sometimes, because so everybody's garden becomes nobody's garden. And I'm always heartened if we have one family working in a gardening project, we're having an impact on 3 or 4 families, because everybody gives their extra produce away, particularly zucchinis, uh, and eggs too, with chicken. So there's this ripple effect that I think people feel good about, but they don't. If it's your neighbor's got a little more extra food, it's less stigmatizing. I think the pandemic, was desperate enough for a lot of people that we broke through that barriers. And people have been willing to reach out for help, but I think it's still difficult. People don't want to be seen as being needy.
One of the first things people will often say to me is, I don't normally ask for help, or I've not usually never or ever asked for help. So they definitely have a certain level of pride that, it embarrasses them that they have to be in that position. But, just making sure they understand that if I don't give it to them, I might have to throw it away, and I'd much rather see somebody eat it than I would, because a lot of my stuff that I get is perishable, and it only has a shelf life or a fridge life for so long. And I don't mind if people take for other families. At our food distributions, we would sometimes give churches 5, 6, 7 boxes to pass out to their community members or their senior programs, or so, that way they get the pride of sharing with others. And a lot of people are still somewhat embarrassed, but I always, make sure that they know that I have plenty to share, and then I would like for it to be used and not wasted.
Thanks to all of you for that question. Let's go to the next. Do you feel your programs are at capacity, or are you continuously expanding to meet the needs of your communities?
So for Feeding Families Prime in Boone County, we bring enough for 150 members. We will not turn away anybody. On paper, we have over 150 people, but I've never had all of the members show up at once. It's very sporadic. So I don't believe we're at capacity. We usually have enough boxes left over to send extra home with our volunteers to give out to their neighbors. So yeah, bring on any more people, and we are continuously expanding. We're hoping to get some more money from the governor's budget and continue to look at the most impoverished zip codes and create more sites.
I would say our capacity would be that we just need the ability to have more staff or permanent volunteers, somebody who comes all the time. Sometimes our volunteers are real sporadic or they don't last very long. I don't have the ability to take on certain vistas or AmeriCorps. I believe there's a fee involved with that. I'm not an expert on it, but that has to come from a hierarchy other than me. I don't have that executive decision to do that. So I think our staffing here kind of limits us to a degree, but we're blessed that we are Monday through Friday. So our food pantry is open. We do have partnerships that have helped us get the food out, or even helped with, if you can pay this much on a utility, I can pay this much. So those kind of partnerships have really helped us keep it moving and keep it going. And if I get too busy, I can always tell somebody to come back the next day. It's not like I'm, can't service you at all. Sometimes it just might have to be a little bit longer, but we do the best we can. So capacity is more with our staffing than it is with the ability to provide the food, if that makes sense.
Thank you.
What I love about the Office of Child Nutrition is you can just expand as much as you need to. I think even with most of our formal sites closed and we were working with families remotely, and but we've still easily served 100,000 meals during the pandemic, even without being able to have face-to-face sites for the most part. And they just, and there's enough money there that if you budget the right way, commodities, we're getting up to the point that groups can apply for getting cheese and ground beef and all sorts of things. Some a little mysterious that kids don't like very much, so you have to be a discerning shopper, but incredibly cheap stuff. Again, you have the problem with food preservation and having to have freezers and deal with having it, with Big Ugly, we had to have a generator because of the amount the power goes out with with summer lightning storms. But that's why I urge that as a good base for that. Yeah, there's definitely staffing is a huge issue, and there is with national. So NCCC is totally free, except you got to get a bunch of church groups to do potlucks. But there is a match that's required for both AmeriCorps and Vista. And that's, when times are tight, that few $1,000s can just not be available, even if it gives you a full-time person.
Great. Let's go into number 4. Do you find you have more people in need of services than you have capacity? And that was the case before the pandemic. It's kind of like the previous question.
I find that the food during the pandemic, huge explosion, especially in the beginning parts. Like I said, from my experience right now, and it's just because maybe of other resources, the food isn't as great, but the utilities and rent, and before the pandemic, it was maybe a $500 termination, where now it's like a $2,000 termination. So where people have gone months and months and months not being able to pay on their rent or on their electric bill, and it's stacked and stacked and stacked. It's made it even harder and harder and harder to come up with that amount of money for each person that calls. So the people in need of services, still great. Our homeless population has skyrocketed, at least here in Charleston. So providing foods, not junk foods, for them so that they can pack around, pop top things because they lose can openers or stuff gets stolen, that kind of stuff. Trying to cater to their needs has definitely, we've increased in that and had to kind of open up more services for that population of folks. But as far as food goes, we definitely have a need, but we've gotten more food than we've ever had before. I mean, it just flows in from all kinds of places, and even whether that's the retail places that we get it from the food banks, from private donations. We definitely don't lack in food. Funding does run tight just because of the magnitude of the bills that people are asking for help with, not necessarily how many people are asking, just how much each one is. That's our biggest challenge.
That's a good point. Thank you.
I think the challenge or the need that I would emphasize is continuity in service. And that both has to do with making sure the resources are consistent, because I loved Amanda's point is that people get hungry every 4 hours. And the gaps, I mean, that's, again, during the pandemic, we've got good relationships with the school systems. They let us use their buses and their gas. We have to pay drivers to take things out. But we kept on doing bus runs over the holidays, when normally if there was school-based food programs, everything would be shut down. Families were still facing those challenges. But the other piece of continuity is how isolated people have been because of the pandemic. And I would be willing to bet that all of our programs have just been lifelines of contact. And even as things got a little easier with people having more money with the stimulus checks, Tammy Bowling is our Force of Nature Big Ugly Community Center director, and she continued to go out and deliver to 80 kids once a week. And the families just wanted that contact with somebody, and contact with somebody that didn't expect anything from them. Families' relationship with schools have been so difficult because of how awful the platforms have been. So where schools and normally might be a source of continuity, they've just been a source of stress for people, and fears that their kids are going to flunk because they don't have enough bandwidth. So I think there is an social and emotional quality to our services, because they know people can count on programs like these 3 programs, and that's, everybody needs more staffing, and that's part of the way for people to be able to see the same faces when they come in for services and have that trust.
Yeah, I completely agree with Michael. Do I find people need food? Yes, of course. There's always going to be that need. But the biggest need that I receive from FFP members is, when's the community classes going to start? They are so tired of being lonely, and it is affecting their mental health more than it's affecting their stomach right now.
That's a wonderful point. Thank you so much for that. So we have 7 minutes remaining. So I think we really have time for one more question, and it's the one that I really would like to get to. If you have a policymaker, if you could have a policymaker here and could make one recommendation to him or her about ways to get more people connected to community resources with a focus on healthy food, what would that suggestion be?
As a 30-year-old in the most remote zip codes in West Virginia, mine will always be affordable, better internet. We keep on telling people throughout the entire pandemic, like, we can't do community classes or health education classes, but here's a YouTube link or here's a Zoom link. These people don't know what to do with that because they've never had internet, or if they do have internet, they can't afford it. Or they're like me, I live in Birch River between 2 mountains, and I have a little hot spot, and if it's cloudy outside, then I don't have internet. If West Virginia could get broadband, affordable internet, we could be more connected to absolutely everybody, whether it be members, organizations, agencies. I'll tell them to help us out there.
That is a great point. Probably not one that people thought of, but that is a really good point.
Transportation, I think Michael touched on it. Transportation is huge. And people to connect. Internet is awesome. Internet definitely is a tool many people need and don't have access to. But I have found and I have learned that using the internet to get things like income guidelines for utility assistance, IDs, all that stuff. Our senior population is clueless. They don't know how to send a picture. They don't have a way to upload something unless they have a smartphone, if they have a smartphone. So those liaisons that can do the outreach, that can drive and deliver those foods, that can go to various places and help them get what they need, or even help them get from point A to point B themselves. transportation is definitely a huge thing. When I see a family of 5 coming here and they're walking and I have to give them food, but I don't want to load them down the stuff they can't carry, but I don't want to shortchange them because, I want them to have everything I can give them. It makes it really hard. So bus passes or gas cards or, something, someone that can take it from point A to point B, transportation is a huge part.
Spinning off a little bit of what both of them just said, Vandalyn just said, gas cards are great. State funding sources don't like to pay for them. Benedum, who's one of our principal funders in the state, doesn't like to pay for them either because they're hard to document and track. But we need little waivers, little ways. I think there is an official rule that you're not supposed to, with Office of Child Nutrition, have somebody pick up for somebody else. But we got to address the real needs of people in rural areas. But the one I would throw in here is I want some stipends and little bits of funding and structure to have an incredible range of youth internship programs who I think could be the legs for a lot of this. We had a program that I loved a number of years ago and we're resurrecting in the summer. It's called Adopt a Neighbor, and it was teens and tweens identifying a community elder or somebody, a single parent, and just checking in with them. I mean, they worked out having CBs to check out with how somebody was doing after a big snowstorm. And I think that these are the folks, man, we want to try training somebody to help people deal with Zoom and internet and sending a utility bill over, we could have that. And to me, that other huge issue is how do we have young people see that they are important and of use in their communities so they get in their heads, this is a place I want to come back to. There will be a role for me if I want to come back. And that motivation has to start in middle school because too many people don't feel that till they're in college. And I mean, I'm a perfect example. I came down to West Virginia as a 20-year-old volunteer during a year off from college. And this was a place that I felt incredibly useful. I was a flood relief volunteer in Mingo County. And I saw a future for myself. I never went back to my hometown in Illinois because I didn't have those kind of opportunities as a teenager. And it's not just a lack of opportunity, it's a lack of people actually visualizing themselves having a role. And there's so many aspects of food security that young people could be a participant in, and elders too. It doesn't have to be restricted to that, but I think a little bit of structure to support volunteers and help local groups develop that capacity would be a big help, kind of a feeder program for the Civilian Conservation Corps.
Those answers were great. I mean, I wasn't expecting two that said address infrastructure. And then one that's kind of another response for a project we're working on of kids affected by the opioid crisis, of folks saying, we're not engaging young people in their communities anymore. They don't have things to do. They don't have kind of that meaningful role to play within their own communities, especially rural communities. So it all is very connected. And so your answers were really wonderful and will be well documented, because I think as this series comes to a close, we're going to look at next steps of ways to educate our policymakers on ways to, better build ways to connect the healthcare system and community support. So with that, we have one more response. John says, in the community, I would like kids, I work with kids building a nature trail. That's a wonderful project. And I bet that's probably something that would qualify for a Try This mini grant. So you may.
Absolutely.
So John will get you connected with that. We are at the end of today's session. So many thanks to our panelists, to the Palatine Foundation of Huntington, our attendees, for this great conversation and a great series. Please note that the series isn't over. We'll be compiling notes from all 4 sessions, identifying prevailing themes, and then sharing an issue brief on challenges and solutions to building better bridges between systems. And then we hope to hold a few community meetings within the 3 counties to discuss what we heard, get some feedback, and see if we can educate some policymakers on challenges and potential solutions. So we be on the lookout for that. And if your community organization would like to host a meeting, please let us know. So thanks again to everybody, and have a great day, everyone.
Thank you. Have a great day.
Okay. Bye-bye.
Thanks, Kelly. Bye-bye.